This YCN segment is brought to you by Bubba's Bar and Grill on Lake Sunapee in Newberry Harbor.
Today on Home Care Matters, the JAMA report looks at new recommendations for colorectal cancer screenings. I'm Jim Culhane. Lake Sunapee Region VNA and Hospice provides healthcare and hospice services, allowing continuity of care and helping people to stay in their homes as long as possible.
Mary Ann Flotty was a loving mother and grandmother.
My mom was the kind of mom the whole world needs. She was very loving, and she did everything she could for us and for her friends.
Before she died, Mary Ann spent 15 days in the ICU after a serious autoimmune disease affected her lungs. Mary Ann's daughter was one of her surrogate decision makers.
We set out to understand how often physicians and surrogates in ICUs have different expectations about the patient's prognosis.
Dr. Douglas White from the University of Pittsburgh Medical Center and co-authors enrolled 99 physicians and 229 surrogates who made decisions for 174 critically ill patients in 4 ICUs at a major medical center. They were interested in discordance.
In roughly half the cases, surrogates had substantially more optimistic expectations about prognosis compared to the physicians, and that the physicians' estimates were much more accurate than the surrogates.
The study appears in JAMA, Journal of the American Medical Association.
In almost all cases, surrogates misunderstood physicians' prognostic expectations. In about half of cases, surrogates held systematically different beliefs about the prognosis compared to what they heard from the physicians.
Those beliefs most commonly included the need to maintain hope in order to improve the patient's outcome, religious beliefs, and a belief that the patient had unique strengths unknown to the physician that would make the prognosis better.
Sometimes clinicians think that all they need to do is to communicate clearly about the patient's prognosis. They may need to explore family members and surrogates' beliefs about prognosis rather than merely conceptualizing their role as conveying the information clearly.
Knowing what I know now, I think I would have asked to just have an honest conversation. This is what I'm feeling, and how does that square with what your understanding is as a medical team?
Catherine Dolph, The JAMA Report.
For more information about the services of Lake Sunapee Region VNA and Hospice, go to our website or give us a call. I'm Jim Culhane. See you next week for another Home Care Matters.